चल शर्मा जी आपको
Check कर दूं?
या
आया?
Hello everyone, we're just starting our show in a minute or so. Just waiting for all the social media to kick in. As you can see, I'm here, Samaji is here, and of course our chief guest is here too.
I'll share with our groups.
Yes, you
Okay, I'll share Diamond Jubilee.
Yeah,
Uh, yeah.
Okay, here we go, guys. Okay, we'll start in a minute, guys. Okay. तो आप करते रहिए जब थोड़ा बहुत तो फिर आप बोलोगे तो मैं करूँगा.
क्या? हाँ मैंने कर दी काफी
Okay.
सारी.
Okay, सलाम नमस्ते सत श्री अकाल आदाब याली मदद मैं आपको होस्ट जलाल आपकी खिदमत में हाजिर आप सब सुन रहे देख रहे हैं सलाम नमस्ते कैलगरी ऑन रेडियो सुरसागर इन कैलगरी अगर आप एडमिंटन में हैं तो रेडियो सुरसागर इन एडमिंटन या तो आप हमें जो फेसबुक पर देख रहे हैं यूट्यूब या इंस्टाग्राम पर देख रहे हैं तो थैंक यू सो मच फॉर ज्वाइनिंग अस फॉर वेरी स्पेशल एडिशन of Salaam Namaste Calgary with me and Salman ji on coronavirus. Yes, coronavirus. तकरीबन कितने 2-2.5 महीने हो गए हमने सुना है कोरोना वायरस. व्हेन आई हर्ड फर्स्ट टाइम आई विल बी वेरी ऑनेस्ट व्हेन आई हर्ड फर्स्ट टाइम तो इट वाज इन दिसंबर सम टाइम मुझे ऐसा जस्ट लाइक जो एनी अदर वायरस so didn't pay that much attention and I think all over the world no one paid any attention on coronavirus. तो वो दिन था और आज का दिन है we are on March the 17th and everything is shutting down. The world is kind of on hold right now. But we'll talk everything with our special guest. But first of all, my only co-host, Salma Jadavji is here. Salma ji, how are you?
जी सबसे पहले सलाम नमस्ते आदाब सत श्री अकाल याली मदद एंड गुड इवनिंग टू ऑल आवर लिसनर्स एंड व्यूअर्स. कैसे हैं आप लोग? उम्मीद है कि सब लोग अच्छे होंगे, सबकी तबीयत अच्छी होगी और सब लोग अपना बहुत 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 ज़्यादा ख्याल रख रहे होंगे. और जैसा कि आप देख रहे हैं कि हमारे स्पेशल गेस्ट आ चुके हैं और आज मैं इनसे एक ऐसे गेस्ट की तरह ही बात करूंगी इवन दो कि वो मेरे हस्बैंड हैं. सो आई विल बी वेरी वेरी प्रोफेशनल टुडे.
We have to.
Yeah. So inshallah we will find out more about coronavirus which has taken the world over right now. And hopefully inshallah you people will be able to find out lots about coronavirus. And if you people have any questions, please write it to us through Facebook and we will try that he can answer you also. So tune with us and we will be talking a lot of important things today. So Jalal, we will start.
Yeah.
So today we have, as you see, those people who are watching us, that we have Dr. Jadavji in our studio, and he's taken his precious time to be with us today. So Dr. Jadavji, it feels very funny. How are you? And welcome to our studio.
Thank you so much. Thank you for inviting me to your radio show and sharing the knowledge with the people who are listening to you and give you a little bit of background about myself.
That would be nice.
Yes, we'll start from there, sir. Yeah. So who's Dr. Taj?
I'm an infectious disease specialist. I have been with the Faculty of Medicine here with the Cummings School of Medicine in Calgary for the past 35 years.
Wow.
And I practice only infectious disease, so COVID-19 or coronavirus is something, which is my passion, and I really will like to discuss this and answer some of the questions you have.
Yeah. So, doctor, okay, so is that okay?
Yeah.
So, I'm going to take you back about 3 months back. It was exactly November the 17th in China. They found the first case of corona, but it was just a normal, like someone had a flu or just influenza or flu or something. Then no one paid any attention, like then on December or December the 1st, there was the first known coronavirus patient in China again. Still, there were a few doctors, about 4 or 5 doctors. They found out. Then of course, then they tried to tell the hospital, didn't work or didn't go through, didn't share, whatever. But then finally, January 20th, China they announced emergency. So what is this virus?
So, Jalal, that's a very good question. Let me just step back and tell you a little bit about the coronavirus.
Yes.
Because that's important for people to understand.
Mm-hmm.
So, coronavirus is distributed broadly in humans, in other mammals, and also in birds.
Birds. Okay.
Yeah, so it is. This coronavirus is something which is there all the time. But humans are infected with coronavirus. There are 4 different strains of coronavirus which infects humans.
Okay.
And so when they infect human, it's a benign condition. You get common cold symptoms like sneezing, a bit of cough,
Yeah.
remains there for 3-4 days and goes away.
Goes away. Yeah.
But then we have got 2 other coronavirus, which is the SARS, which was in 2002, 2003.
Yeah.
That was also a coronavirus.
Okay.
And then in 2012, we had another coronavirus causing MERS, which is the Middle Eastern
Okay.
Respiratory Syndrome. That's a coronavirus. So both of these coronavirus came from animals.
Okay.
All right, so which we know that this coronavirus circulates in the animals. And when it mutates, so it changes itself and can infect the human beings.
Okay.
So when it infects the human beings, because nobody has experienced this virus, so you get very sick with it. So remember SARS?
Yeah.
Lots of people
Lot
were
of
sick,
people, yes.
and lots of people died as well.
That's right. Yeah.
And then in 2012, the Middle East Respiratory Syndrome, again caused by coronavirus, but again also from the animals to the humans, and it affected group of people and spread to other parts of the world, and a lot of people died as well with that virus. Now this is the 3rd time this coronavirus is coming from an animal source.
Okay.
So usually bats are the ones who carry this.
Yeah.
In the first one, the SARS went to an animal called civet, which is very similar to cat,
Okay.
and then transferred to the human beings. And then the MERS was from the bats to the camels,
Camels. Okay.
and then to the human beings.
Human being.
We think this one is from the bats. It has gone to an animal called pangolin, and then it is like an armadillo type of animal.
Okay.
And then we have come in contact with it, so this is what we think that this 3rd virus has come from. So it has really, and as you mentioned, actually China described this on December 31st and informed people
Right.
that they have seen clusters of people infected with a new virus.
New virus. Yes.
So at that time, they made this, they informed the world about this. And in fact, China this time was so efficient, and within actually 2 weeks, they found out that this was a coronavirus, which is a novel coronavirus. Initially, it was called as novel coronavirus, infecting many people in China, but mostly people who visited Yuan in a market of seafood and animals,
Yes. Yeah.
and that's where most of the people were infected with this particular virus. And they got sick, and then China also sequenced the entire genome of the virus. So very quickly they have come up with this. It becomes easier now that when you've got the entire sequence of the genome of the virus, to target the medication and also the vaccine, if you want to produce that, you will be able to do that.
So, this virus was there in the bats or armadillos, as you say. So it was there, and people were coming in contact with this. So how come the severity of this virus is so much more than before? Like, what is the?
Yeah, so that's an excellent question,
Yeah.
because what happens is, so it is circulating. So normally, we don't get viruses transferred to humans from animals,
Right.
because usually that doesn't happen. However, because when this virus mutates, so changes the characteristic,
Okay.
and then at that time it can infect the humans.
Okay.
And once it comes in the human, so you probably have heard about the avian flu.
Yeah.
Right.
So there are avian flu which were very severe. Humans got it, but it never became pandemic,
Yeah.
right?
That's right.
So there is something to learn here. So that means it didn't become that, because pandemic only occurs when there is a human-to-human transmission
Okay.
of
That's
that
what
new
it-
virus,
that's
of
what
that
it-
new virus.
Okay.
Yeah.
So that is the reason, that because in a very short period of time, we found out that if it efficiently spreads from human to human, and we started seeing more cases of that. And that is the reason when it happened in China, and people thought that it will go away,
Right.
and they started seeing more and more cases. It spread from one province to almost every province in China.
Mhm.
And then, because now travel has become, so
Yeah.
short, and
Yeah.
then we travel, and within 12 hours, we are into different place of the world.
Right.
At the same time, you have to remember the incubation period of this. And
Mhm.
basically, incubation period means that if I am infected with this virus today,
Mhm.
it will take anywhere between 2 days to 14 days for
Right.
me to develop symptoms.
Symptom. Yeah. Yeah.
So if you boarded a plane in China, you may be totally asymptomatic. So you don't have symptoms.
Yeah.
So it's a time of incubation period.
Yeah.
However, you can still be infectious when you're not having symptoms also.
Mhm.
Right.
So now you have landed in Calgary,
Yeah.
from China to Calgary,
Yeah.
and now you get symptoms. You have infected many other people without you knowing that.
Until you know yourself.
Of course.
Wow.
Yeah. You would not know.
You will know, yeah,
No,
because it
because
takes
the
about
incubation period
2 to
is that
14
long.
days. Yeah, because I was listening, so like I was listening to other radio. They're saying, like if I have the bacteria, if I give it to you, so you'll see the result in 3 to 4 days. But myself, I won't know until the 2 to 14 days, as you said.
It's an incubation period.
Yeah.
So
Yeah.
in some, it may come very quickly. In some, it can remain there up to 14 days, and then you develop symptoms.
Wow. So when you have, of course, now we are talking regular flu as well, or
Right.
regular sneeze or whatever.
Right.
And now I think when it started back in December, so of course people didn't pay attention, especially now the Northern America, because that's kind of and the Europe now. So then why didn't we learn from China? What happened in December in China? Why didn't we learn in January, February here, like in North America?
Well, so that's interesting, because I think people really did not know at that time how bad this virus will be. And most of the people thought that probably it will remain in China only.
Oh, okay.
All right. So that most of the people thought that.
Mm-hmm.
Then we started seeing cases. So you started seeing cases in Korea,
Yeah.
and all of a sudden, and remember what happened in Korea, that they got one case, and in a short period of time, thousands of people were infected. And in fact, there was one person
Mm-hmm.
who attended a funeral where
Oh.
there were 3,000 people there, and subsequently they found out that the large number of people who were there at the funeral also got infected and got symptoms as well.
Mm-hmm.
So the point you are raising is that we have to be very careful. See, sometimes we forget the history lessons.
True.
And what happens is when you get a new virus,
Mm-hmm.
We know that well that virus is going to go around in the world.
Yes.
When World Health Organization declared this
Yes.
as pandemic,
Yeah.
that means it is serious.
Mm-hmm.
The reason it was pandemic is because now they have seen in a very short period of time,
Mm-hmm.
there were a number of countries in the world
Yes.
where they started seeing cases.
Yes. Yeah, actually, it was on March 11th, and that time there are 140 countries, 114 countries that
Right.
time. Yeah.
Yeah.
So I have a question. So we knew about this virus. It's not that we came to know about this virus when they found out in China. So like the vaccines we have produced for other viruses, how come we didn't put this strain into the vaccines?
So, so remember, we knew about coronavirus.
Yeah.
This has mutated.
Oh,
So
okay.
remember,
That's the reason.
well, this virus is a novel, it's a new virus.
Yeah.
So we really, if we had made a vaccine for coronavirus,
Yeah.
it probably won't
Would
be
have.
effective against
Yeah.
this particular novel virus.
That's right.
So that's a difference,
Yeah.
that this virus is a very new virus, that's why it is called novel.
No one.
And that's the reason, so remember, your symptoms, there are lots of, during winter months, we get a lot of viruses circulating in the community.
Yeah.
Most of those have got very similar symptoms. So the symptoms you get with coronavirus, so you get high fever,
Mm-hmm.
you will get cough, you will get sneezing, and then you will get shortness of the breath. And most people will think that this is a flu-like illness.
Flu.
And that is the reason, because now we have got these different viruses circulating, and that's why we insist that people should take flu vaccine, so that most people, if they would have taken the flu vaccine and they get symptoms like this, then we know that, well, this is not a flu, this is something else. So right now, if people, when they get these symptoms, they have to be careful, They can't just say that this is a flu virus
Yeah.
until proven otherwise. Because one case of corona can infect 2 or 3 people right away.
Right.
And that is the reason, when you look at that, the multiplication
Yes.
is so fast that after 24 to 48 hours, you said that, well, we had only about 10 cases,
Yes.
and now we've got 70 cases.
Yeah.
So this happens when you've got so many people getting infected,
Mm-hmm.
and other people will get infected from those people as well.
Mm-hmm.
The people at risk, the people who are at risk of this are elderly people,
Mm-hmm.
those who have got underlying diseases such as diabetes,
Yeah.
heart disease, lung disease, somebody who is a smoker for a long period of time,
Mm-hmm.
they are at a higher risk of getting severe disease with this.
Mm-hmm.
So even younger people who are healthy but they have got underlying disease,
Okay.
they
So
can
they
also
still-
get severe disease.
Yeah.
And then the other group, which can get very serious disease, are the ones who have got low immunity for a number of reasons.
Yeah.
And they can get sick as well very quickly.
Mm-hmm. So when like when it started, so they said this is not like you can say danger as the SARS, because it's only 2% rate for the dying rate. That's what they're saying. Like 2 people can die out of 100. But now look at the numbers. Now it's growing. It's more than SARS now. So we were wrong earlier, or the way it is.
No, so when you talk about death
Mm-hmm.
and you compare it with SARS and you compare it with Middle Eastern
Mm-hmm.
respiratory syndrome, it is still lesser.
It's still less.
So we are talking about maybe 3 to 4% death with the COVID-19,
Numbers right now. Yeah.
where we are talking about, you see, so 3 to 4%,
Yeah.
whereas for SARS, we are talking about 9.5%.
9 to 10. That's right. Yeah.
And then for the MERS, for the Middle Eastern respiratory syndrome, we are talking about something like 30%.
Oh wow.
So from the death point of view,
Yeah.
those are nasty viruses.
Nasty virus. Okay.
However, from the spread point of view, this is a nasty one.
So then this is more dangerous.
This
Yeah.
is more, it will
dangerous
in
because
fact,
of the.
it will infect a larger number of people
Yeah.
in a very short period
Very
of
sure.
time.
So now we know that it's been declared pandemic, okay? Now people are taking precautions, countries are taking precautions, self-isolation is important. So do you think all these things are really important so that people who are being very, okay, we won't get it kind of an attitude, then those people should know the importance of self-isolation and being away, because some people have found out through, that they are not taking it very seriously. So what is the?
So that's the most important thing which you have to, let me step back and tell you
Yeah,
that how this virus is spread.
yeah,
Mhm.
Then it becomes easier
Easier.
for us to understand.
yeah,
So remember that this virus spreads by droplets.
Mhm.
So somebody sneezes,
Yeah.
somebody coughs,
Mhm.
somebody speaks, you are spreading the virus that way. That's number one, all right? The second way you can spread the virus
Mhm.
is that any surface
Okay.
which has come in contact with has also got the virus, and if you touch that surface, you can transmit the virus yourself,
Mhm.
or other people can get that virus too. The third way we can get this virus is through our hands.
Okay.
And so we have got a habit of touching our nose,
Yes.
touching our eyes, touching our mouth.
Yeah.
And the studies which people have done looking at how many times in 1 hour
Mhm.
you will touch this area.
Yeah.
And we call this area as a T-zone.
T-zone. Okay.
T-zone is your eyes, your nose, and your mouth.
Okay.
So that's a T-zone. So people have looked at that, and people said that you touch these areas in 1 hour between 20 to 24 times.
In 1 hour.
yeah.
1 hour.
We're not
Without
realizing.
you-
So every second minute you are
So
touching it.
without you knowing,
Yeah.
so without you knowing it,
Wow.
and that's how you can spread it. So if you have touched the surface where the virus was,
Yeah.
the chances are you will transfer it in the areas where it goes.
Right.
So we know that this is how it spreads. When you know that, it becomes easier for us to understand how we can take precaution to prevent this transmission.
Mhm.
And the reason that the transmission is so important is because at the present time, we do not have an effective vaccine,
Right. That's the huge problem.
and we do not have an effective antiviral agent to treat this infection. So remember, we do not at the present time have a vaccine, and we do not have any medication, specific medication to
Yeah.
treat this
Yeah.
infection. So we know that the only way we can decrease, and so important thing is I mentioned earlier, that one case of corona or COVID-19 will infect 2 to 3 people, all right?
Okay.
We don't want that to happen. We want to flatten the curve,
Yeah. This
So-
is the famous word right now.
all
Yeah.
right?
Yeah.
Yeah.
So when we say that we are infecting 2 or 3 people, it will continue to spread. If you put it down to infecting 1 person, you really put it down to the flattening of the curve.
Flatten the curve. Yeah.
If it goes below 1, then we know that the transmission rate
It's
will
going
really
down.
decrease.
Yeah.
So the question comes up, that, well, how do we do this?
Yeah.
And the most important thing, so now you know that, well, how you acquire this
Yes,
virus,
yes,
so how
yes.
you are spreading. So you are spreading it through cough,
Mhm.
you're spreading it through sneezing, you're spreading it through speaking as well.
Yeah.
So you have to take precaution in preventing doing that.
Yes.
So when you sneeze, you either sneeze in a tissue paper and you throw it in the garbage.
Right.
Or you sneeze in your sleeves or you cough in your sleeves or elbow.
Okay, so yeah, because I was gonna ask you this too, because that's what they're saying. You sneeze in your elbow.
Yeah.
So what about the shirt? Because of course it's gonna affect the other person anyway.
If it
So-
touches,
Yeah.
So-
if it touches.
Yes, so remember, the chances of that person coming close to you
Yeah.
is not that very high, that close,
Yes.
all right? Unless you want that person to be,
I'm interrupting you.
Yeah.
So how long does this virus stays alive?
Yeah, it stays alive in your.
good question, so studies which have shown that it can stay on the surfaces
Yeah.
up to 9 days.
9 days.
Up to,
Oh my
on the
God.
surfaces, so depending on the type of surface, depending on the type of surface. So people say that, well, if you have got a copper covered surface, it may not stay there for that long.
Mm-hmm.
If you've got plastic, then it may stay longer than that.
Wow.
So we know that this is,
Okay.
and I'll come back to that,
Yeah,
how
yeah.
can we do that? So that's one important thing. That you do that, you have sneezed or coughed in the tissue paper, you make sure that you throw that in the garbage,
Mm-hmm.
right? Those people who have got symptoms, they should try to avoid coming in contact with other people.
Mm-hmm.
That is what government is trying to tell you,
Tell you now.
that isolate yourself. All right, that is the advice given to people who have gone to those countries, have come back, and they say isolate yourself for 14 days because the incubation period is 14 days.
Right.
They may not have symptoms, but they may develop symptoms after they have arrived in Calgary.
Right.
So you isolate. So if you are symptomatic, you keep yourself away from everybody,
Mm-hmm.
and especially from those people who are at a higher risk. That is your elderly, those who have got underlying problems like heart diseases,
Mm-hmm.
like diabetes, then you've got, or immune problem. If your immune system is weak, you stay away from them.
Mm-hmm.
All these measures which government are talking about, which is you're distancing yourself,
Yes.
that is very important. Not going to your prayer house, like masjid or temples or gurudwaras, churches, because we know that there will be lots of other people there,
Right.
and you will be impacting those people as well.
Right.
You can say your prayers at home, for that time period when we are trying to flatten the curve of this disease itself. So that's another way of preventing. The reason we have closed the schools, the reason we have closed the daycares is for the same reason.
Same reason.
All right, because those children, remember this disease is not very severe in children. However, they may be asymptomatic, but they carry the virus.
That's how they. Yes.
And if they meet their grandparents
Yes.
who are more susceptible
Transfer. Yeah.
in causing more severe disease, they can give it to them.
Mm-hmm.
And their chances of them dying is much higher.
Mm-hmm.
So these precautions which we are taking are very important. Everybody has to listen to our Chief Medical Officer of Health in Alberta,
Yeah.
who gives a conference every day, updating everybody
Yeah.
the important tips about this virus.
Yes.
Dina Hinshaw
Yeah.
regularly gives that,
Yeah.
and I think people should listen to what she has to say, because these are the steps everybody wants to follow.
Mm-hmm.
When anybody breaks those,
Yeah.
you will see that you have broken the chain of the transmission as well.
True. Yes.
And that is important, not to break the chain.
Mm-hmm.
These are important things which we need to follow.
Mm-hmm. So as of today, so I'm just gonna back here. As of today, so it's like in total cases we have in Canada, it's about 400 in Canada, and about 8 people died, and there are 7 just alone in BC, and then altogether 180,000 cases in 160 countries. Then US, it's exactly the same. There are where did my notes go? There we go. Sorry, guys. I'm just looking for.
Don't want to give the wrong number.
No, yeah. Then in the US as well, start from Chicago. It was a day after from from our Toronto day to like it was January 24th. So like if you ask anyone in the world, where is the best healthcare system, they'll say North America, Canada and US. And I think these two countries are the more, you can say like now in danger now, because the numbers are going up, restrictions are going up. Even today, like as of today, in Alberta, like bars and everything now closed down now, and only the restaurants they can have only 50 or less, like half of their capacity. It means the government is trying their best. It's up to us now. But like knowing people or knowing human being, we don't listen. Especially in because I've seen some pictures in Florida, people are still going to the beach. Thousands of people are still going to the beach. So what can we do? How can we teach those people?
So Jalal, you have raised a point about that our healthcare system is excellent. There is no question about it.
Mm-hmm.
In all developed countries,
Yes.
we have got an excellent. I think where we failed, we did not take the steps very early.
Mm-hmm.
That's where we have lost the ground.
Okay.
When we have lost the ground, many people have been infected.
Yes.
When that bottom line, the number, when it is large, you have subsequently infected many other people, and that is the reason the number keeps on increasing.
Yeah.
I think initially people did not think that this is serious.
It's gonna get serious.
Yeah.
No doubt.
I'm not saying that you have to panic.
Mhm.
That is not. There is a fear. There is for sure there is. When there is pandemic, there is a fear. I'm not saying that you have to panic. If you start panicking, your thought process also will change.
Will change. Yes.
You will not be able to think properly.
Yes.
I think people have to realize, what I talked about, the precautionary measure. People have to realize washing hands is so important.
So important now.
It is not just taking little bit of the sanitizing or soap, just rubbing you have to take 20 seconds, rub your palms properly, rub the back of the hand properly on both sides, put your fingers in between, rub it that way in front,
Okay.
rub it at the back as well. Just keep on rubbing your thumbs, both sides, and also up to the wrist.
Wow.
Yeah.
Okay.
You have to take time to do that. It is a good time because your children are home. You can start practicing with your
Practicing,
children.
yes.
They will learn as well. As they grow up, they will know the technique of how to wash their hands as well.
Mhm.
And I think that is important.
Mhm.
As I mentioned to you, that this virus remains on the surface, we want to make sure that we wipe off anything we have come in contact with.
Mhm.
And it's an easy solution, easy solution in the sense that, well, if you take between 60 to 70% of the ethanol and rub the surface for 1 minute, clean it up, you kill that virus. Or you can take hydrogen peroxide.
Mhm.
That can also kill the virus easily. Or you can get sodium hypochlorite, like Javex.
Mhm.
Javex will also.
Okay, so we know these things will affect.
Yes.
So is there any way we can take in the human body these things?
Well, the Javex,
No, I'm just
Javex, of course, when you rub it on the human, you can't take it by mouth.
Okay.
Sure, it is a toxic substance.
Yes.
You can't. But also Javex, you need to dilute it
Mhm.
before you use it because it is a corrosive.
Correct.
So it does, affect the surfaces as well.
Mhm.
So travel is another thing.
Yes.
People who have come traveling from
Cruise.
outside,
Talk about cruise. My God.
You know-
Okay. Yeah.
you need to follow the rules.
Yeah.
You can't lie to, so we have heard the stories that
Mm.
people who come to the hospital
Yeah.
who have traveled, and when we asked them initially, they said, no, we have not. And later on, we find out that yes, they did travel,
Mm.
and now they have got symptoms with it. I think it is important to be honest. I think every citizen has got a responsibility
Yes.
to take this precaution. Otherwise, I can tell you that this will continue for months
Yes.
if we don't take it.
That's what. Yeah.
If you don't flatten the curve right now, this is going to continue for months. We have history behind us. We have learned from that. 1918,
Mm.
we had a pandemic influenza
Mm-hmm.
which killed 50 million people in the world in 1918.
50 million.
50, 50.
Oh.
50 million people died of pandemic influenza in 1918.
Mm-hmm.
And when people took this precaution,
Mm-hmm.
and what happened was that when the virus was coming down, the infection was coming down, people said, oh, fine, now we can go back and do.
Yeah.
All of a sudden, the numbers started rising as well. So all of these precautions have to be taken seriously, and we want to make sure that we keep ourselves safe and healthy,
Yeah.
and it is our responsibility to keep other people safe and healthy. We don't have to become crazy. I think we still need to communicate with each other.
Yes.
We have to remain sane, because these are the times when isolation will cause a lot of mental anxiety.
Yes.
So this is not something which we need to do, So
Mhm.
don't panic, but use common sense, use the simple, regular stuff, what we are talking about in decreasing the transmission of the virus.
So,
Yeah, go ahead.
so how much are the families of the doctors are safe, because they are like, I'm talking
Doctors
them-
and front line,
yeah,
yes.
as
Yeah.
the practitioners and hospital
Airport,
maintenance people,
yeah.
and so what precautions those families should take, because the doctors are not going to stop going to the hospital, and all the nurses, they are doing such a good job right now. They are there so many hours. So what precautions should the family take of these people?
So, for example,
Yeah.
see, I look after all the patients. I'm a frontline person
Yeah.
right now because of my subspecialty of infectious disease.
That's right.
I go to work,
Mhm.
I come back home, you are home.
Mhm.
Now, if I come home and I start feeling symptoms, for example, sore throat or fever,
Mhm.
I will inform my hospital
Mhm.
and I will say that, well, I am sick and I'm not going to come to the hospital till I get tested.
Mhm.
Because you are asymptomatic, you have come in contact with me, you will not be able to go out of the house as well,
Right.
because you may remain asymptomatic and you may not carry the virus.
Mhm.
And if you become symptomatic, then you need to be tested as well. We cannot come in contact with other people
Mhm.
when we have got that.
Mhm.
It has happened recently in our hospital as well,
Yeah.
that some of the doctors who felt sick phoned in the morning, asked some replacement, they called the medical officer of health or 811. Don't call 911,
Yes.
Yeah.
call 811.
8-1.
Right.
Don't go to the doctor's office because you are going to infect others.
Mhm.
811 will guide you where to go, get a swab, and within 3 to 4 days, you will get an answer. All right? For God's sake, don't appear at the doctor's office when you have got symptoms, because you are going to infect a number of people who are present there. Don't go to the emergency department,
Mhm.
because if you do that, the chances are you will infect so many people and this cycle will continue. 811 is the best number. However, so if you have got symptoms, you call 811.
Mhm.
If you have got really shortness of
Yeah,
breath,
that's what my next
severe
question-
chest pain, and you think, that, well, no, you need it, then you have to go. But then call 911 and let them know
Yeah.
that this is what I'm suffering from.
Mhm.
So they take precaution themselves. They also put you in that sort of precaution. And when you arrive at the emergency, they will take a precaution, making sure that you don't come in contact with other people.
Other
Yeah.
people.
So these are the things which people are kind of not understanding, like the way you have explained regarding the other people and the families of the physicians. So this is why there is lot of unknown, like people don't know properly, and this is happening. So, like, why my question is that when everybody's telling them the right thing and they are not doing it. So what is that? What is it which is why people are not listening?
It's it's a human nature. It's a human nature, when you don't see illnesses in yourself, or you have not seen, that how many people in the world have, sometimes you take it very easy. For example, when we closed the school, when we closed number of areas, people started having private parties at their house.
Right, yeah.
It is a dangerous thing, and then we post it on social media so that other people can see that we are having lots of fun. Not realizing, and I am not blaming them, and I think they do it with a good motive, saying that, well, we'll get together, so everybody can get a good time. But this is not the time to do
It's not
it.
the time.
This social distancing is so important, for your family and for the others as well. So making sure, that if you've got symptoms, you don't really come in close to contact with. If you come back from travel, you isolate yourself. If you are, if it is not an essential travel, you do not travel at this time.
No, yeah.
So these are important things.
So there are so many people are watching, guys. Thank you so much for joining us, including your own Amina Jadavji. Hi, mom and dad.
Yeah, I said hi to her.
Then is Sunmona from Winnipeg. Rishma is watching from Northwest Jamaica. Rishma, Mandeep, Sheza, Kemi from Edmonton, Happy, Azmina, Shalus, and Monira Farzana. Lataji, hello Lataji, hello to Dr. Jadavji as well. Sultan Jesani from Toronto. Rachna, Al Karim, Gul, Abid Khan, and Nurdin Taj from Chicago.
Yeah.
Kareem, Alauddin, Hanif, Tracy from Houston, I believe hello Tracy, and Humaira, Sultan Makhani, and Jay Chaudhry, Leila, my wife, my other half, Kashif, Shamira, Almurda, and Munira Premji, Alicia, Nasreen, Alnur, Murat Fedai, and Shailene, Fazal Khan, Nahin Charania, Melissa from Florida as well. Hello, Melissa. Roshni from Vancouver, Sadrul Ban. Hello, Mukisa. Thank you so much. Gurmeet, Munira, Stacy, Riaz, Hanif, Nizar, Asif, Zishan, Ajay, Shamsha from Toronto, Zain, Alnur, Shams, Seema Gilani. Hello, Seema, Yasir, Javed, and others watching on Instagram as well as YouTube.
Yes, thank you so much for listening and watching us. But if anyone has any concerns or any questions to ask, please send it to us and then he'll try to answer you. If there's anything which you are confused about or you want to know more about, so please write to us. So there's a big message I can see.
From Amina, if you know reading.
Okay.
So if you remember 9/11. After 9/11, everything changed. Our security system. If you go for any job, they ask you for your background check, this and that. Now we heard something new normal for us, from Dr. Dina. This is new normal for us. New, you can say again, self, what you do for the self. आप जो भी करते कर और what's the word, self
distancing,
soft distancing, or no more gathering, or then make sure wash your hands, like you said, 20 seconds. This is all new for us now, new normal. So especially for kids, I think you said if we're gonna do it at home, they will learn from now. So when you see the world now, after 9/11, everything changed, the new system. Now this thing is new now. So after this, what you predict? What will change?
So see what happens, so when SARS in 2002, we were not prepared for it.
No.
And I think we saw so many deaths. But remember, SARS, most of the people who got SARS happened in the hospital. All right? Because they came to the hospital. They were sick. We didn't take proper precaution at that time. And that is the reason we infected number of people. Since that time, SARS has gone. right? Then we saw Middle Eastern respiratory. Now, Middle Eastern respiratory virus or syndrome, also caused by corona, has not gone away. It is there. And but it is not there throughout the world. So it's isolated. Influenza, some pandemic influenza remains with us in the community, but now, because we have got antibodies, we can now tolerate that well.
Okay.
With this new coronavirus, we will see what happens with this. Whether this is a short-lived or it will go away. But I can tell you what will happen. Because it is one of those viruses, which is a common virus, circulating everywhere. We will probably have a vaccine for this, and most of the people will be vaccinated, and we will be able to prevent this. I can tell you what will change. Because there are so many different coronaviruses in animals, circulating in the animals, in other mammals, like bats and birds. Because we are in close proximity with the animals now more than before,
Right.
there is a chance that these viruses will mutate and will come and infect the humans. Now that the way it spreads, that this virus very easily can be transmitted from human to human, you see the pandemic at that time. And I think what will change for future is that we are going to take more precautions in keeping ourselves, washing hands properly, trying to, break that habit of touching the T area, like eyes, nose, and mouth. We will do our best. Remember, once you form a habit, it becomes very difficult. You can't change that overnight. But we will become more conscious about it. And I think we will start doing those things appropriately. The third thing which will change, I think we will take it more seriously now in future when we get a novel virus causing infection, because we didn't learn from our past, and this one also we took it lightly initially, not realizing that in a short period of time, this is going to infect a large number of people in the world.
So we'll be very, very careful now. And the only like the best thing you can wash your hands. That's the best part you can do.
Wash your hands.
Don't touch your T area.
Etiquette, sneezing, coughing etiquette, those are important things.
Important things.
And
So
then
much-
also disinfect the surfaces if you think somebody has visited you. So that will help us also. Yeah.
Okay, there is a question from the Sultan Makhani.
Yes.
He's saying, Dr. Jadavji, is someone has common cold, but he needs to visit his doctor clinic for refill, for the refill of the prescription. What can he do? Okay, because there's some doctors required to go in person to get the prescription.
Good question. That has changed now. So previously, doctors will not give you prescription on the phone.
Right.
With the coronavirus going on or COVID-19, Alberta Health Services have mentioned, that, you can phone your doctor.
Okay, well, there is it. Okay.
Yes, and they will send the prescription to the pharmacy.
Great,
So this is something which you can do.
great.
And there is a question from Amina. Okay, like a lot of people are saying not to take anti-inflammatory medication if experiencing COVID symptoms.
So, this is something which people have seen it with other infections, that certain non-steroidal anti-inflammatory can really produce more severe symptoms. We don't know that with our COVID-19. Some people said that yes, you should try to avoid it because we don't know that.
Yeah.
And that's why you should take Tylenol to control your fever and control your muscle aches, And I think it's a good policy when you don't know about certain things which has happened in the past.
So
Yeah, good. So I have a question now. Lots of people are putting out on Facebook and social media that like hot water, how much is hot water effective? And there are
Yes.
people saying that if you boil some ginger and black pepper in the water, and then you keep on drinking whole day hot water. So how much hot water or something like that is effective towards COVID?
You see, what advice I will give you is, for God's sake, don't spread rumors and don't spread something which is not the truth.
Okay.
So when you talk about, drinking hot water and that is going to prevent or that is going to wash the virus in your stomach and the acid, there is no basis to that.
Okay.
All right, remember, drinking ginger, it helps to soothe your throat. It really does not help to prevent this infection. So I don't think there are studies, if you want to drink the ginger water, you can drink it, it is not going to cause any harm.
That's
But don't go and tell people, that do this and you're going to decrease the infection rate or decrease the transmission. So that is my advice to people. When you're not aware of something, please do not start spreading rumors about this. It is important that you listen to the right people in the province, like Dr. Dina Henshaw, because she gives you all the right messages. If you are really not sure about it, phone the right person who can give you the advice on this. But I think, that when you get an email or when you get it on the Facebook saying that, oh, there is a treatment available now,
Yes.
you can go and buy it on eBay
Yeah.
or something.
Yeah.
Please do not do that. You are going to waste your money on this. You are going to really cause a lot of harm to yourself because you don't know that that medication is going to cause you more harm or good to you. So I think, that is the reason. When medicine, there are studies going on right now, that there are 3 medications which have been used for this particular novel virus. But those studies are at the present time being done. We don't know the outcome of that. The vaccine study has been started, but we do not know the outcome of that. So I think when the studies results are out, everybody will come to know that very quickly.
Very quickly, yeah.
Because this is not something which will be hidden
Yeah.
from the
No,
public.
no,
Yeah.
of course.
That's right.
And so, because especially like in our South Asian community, like our community, or especially in Pakistan, India, so we live in a family. There are 4 to 6 to 8 people in one house. So here we see, let's say you have symptoms, and there are 7 more people, 6 more people, or 5 more people in one house. So then, what are the restrictions, and what are the precautions for everyone?
So Jalal, when you have got somebody symptomatic in that family of 8 or 10 people, extended family living together, you have already infected everybody.
Yeah.
So you remain in the same house.
Okay.
You remain in the same house. You wait for 14 days because those people, if that was a COVID, you go and get it tested yourself,
Yes.
making sure that, if this is COVID-19, you inform the public health people that these
Okay.
are...
There is no shaming. Like there is no shame. If you have COVID-19, there is no shame because a lot of people are still hiding.
There is no
community.
stigma.
Yeah, there is no shame for it.
stigma. There is no stigma.
Yeah.
There is no stigma. This is just like an influenza virus.
Yeah.
So this virus is going to circulate in so there is no stigma to
Yeah.
that. So I don't think people should be worried about that.
Yeah, exactly.
The virus, anybody can get it.
Anyone can.
Yeah, there are no borders to that.
Yeah.
No virus can affect
Yeah,
anybody.
right.
So remember, that, if you are in that same family, you've got symptoms, the chances are you're already infected. So make sure that all of you stay in the same place. You get tested, you will get an answer. And if you are positive, anybody becomes, symptomatic, we know that is most likely will be that. Now, in that same family, if somebody else now,
Yeah.
and you have got an elderly person,
Yeah.
or who is at a high risk, and he gets a severe symptom, you know that most likely it is COVID-19. So that is the reason that you have to inform the hospital, in saying that, has come in contact with this, has got severe symptom, the chances are they will admit you directly to the hospital.
So now, all these people are in self-isolation, especially elderly people who are by themselves. So nobody's visiting them just to make sure that they don't get infected and they are not going out. So is it going to really help them just to be self-isolated, or after how many days or weeks so they can come out? What do you think about it?
Well, so remember, isolation can cause a lot of mental anguish and anxiety,
Right.
and especially for elderly people, who really, for example, a lot of elderly people go for prayers,
Mm-hmm.
and that is their social contact.
Yeah.
That is or they probably go to a community center where they play cards or some games,
Yeah.
and that's it. Now, of course, that is going to impact on their life.
Mm-hmm.
What we need to do is, making sure, that, well, whatever media we use,
Mm-hmm.
we try to connect with them.
You're right.
That is very important.
Mm-hmm.
For example, those people who are living in a seniors home,
Mm-hmm.
there are people who are working in this, for example, nurses are there, other people who are working there. We also tell them the same thing, that you may have to pay more attention to them, talk to them on regular basis, I know everybody is busy, but those are the things we can do, The question you have brought up, that how long?
Yeah.
It's not a question of how long, the question is that, well, this is how long this is going to go on.
Mm-hmm.
It may take 2 months,
Yeah.
it may take 3 months, it may take 4 months. It all depends on every individual person
Depends on us. Yeah.
who are abiding by the rules and regulations of decreasing the transmission of this virus.
Mm-hmm.
That is
There
so
should be
most-
no break in the chain
Yeah.
doing that.
Yeah, yeah. And this afternoon I was listening to Dr. Dina. So she was saying, now of course it's getting higher right now. You might see the numbers going down in the summertime, but in the fall it might come back again. So we have to be taking care of ourselves.
Yeah, so, we don't know that, so.
No, it might, yeah.
No, we don't know that right now. I don't think the numbers will go down right now. Maybe the numbers will increase.
Increase and then.
Then, you see,
Yeah.
but at the same time, what we don't know about this coronavirus,
Mhm.
about the impact of the seasonality.
Okay.
Everybody thinks
Mhm.
that when the temperature is warm,
Right.
maybe it will subside.
Yeah.
Everybody thinks that. We don't know that. We don't know that.
We don't. Yeah.
Now, if that happens, which is a good thing, in the sense that we are buying time, by
Mhm.
that time, we probably have got an effective vaccine.
Vaccine. Yes. Yes.
Right?
Yes. Yes.
And so people will be vaccinated, and then we are not at risk for other people.
Yeah.
The transmission will decrease.
Yeah. Yeah.
So that is important.
Mhm.
So there are lots of unknowns as well.
True.
Yeah.
True.